Next, from Collinsville, U.S. Senator Dick Durbin speaks at the annual Joseph Bartlack dinner and recounts the contributions of Ulysses S. Grant and Abraham Lincoln toward America, as well as discusses the nation's growing heroin epidemic. This runs about 20 minutes.
This is the first time, I believe, that the Downstate Lap Dinner has been held in Metro East. And who could be better as our first keynote speaker at this location than Senator Dick Durbin? Born in East St. Louis, a graduate of Assumption High, whose connection to East St. Louis and the Metro East has remained so strong through the years, and a political leader whose career has included a major focus on both justice and health issues, the two issues that intersect at this dinner and within LAP. One of my favorite memories of Senator Durbin was when he came to Land of Lincoln's new offices in East St. Louis a few years ago in a building purchased and then completely renovated with the generous donations of Metro East attorneys, some of whom are in this room. As we sat and talked about legal aid in my office, it was clear that his concern for the legal rights of the poor and elderly and his affection for his birthplace had remained strong throughout the years. Senator Durbin is, of course, not only the state's senior senator, but also the Democratic whip in the Senate, a position he has held since 2005. His committee appointments, including especially his seats on the Senate Judiciary and Appropriations Committee, have put him in a particularly strong position to advocate for justice, and he has done so vigorously. He has been a strong and effective leader in efforts to support the Legal Services Corporation. He was instrumental in creating and preserving and expanding the program that allows public interest attorneys to have federal student loans forgiven after 10 years of service. He's been a leader on sentencing reform and also on access to justice for victims. And yet his effect on justice in Illinois may have been most profound through his role with the federal judiciary. Because of the bipartisan approach taken by the senator and his colleagues in Illinois, Senator Durbin has now played a role in the selection of 80% of the sitting judges in federal courts in Illinois, and they are an exceptionally talented and well-respected group. Senator Durbin's achievements obviously go far beyond the justice system. He has been a leader in ensuring that mental health and substance abuse services are available to those in need through his successful leadership to implement and preserve the Affordable Care Act, to expand VA health services, and to expand Medicaid eligibility. And he has more recently introduced the Addiction Prevention and Responsible Opioid Practices Act, legislation aimed at the heroin and prescription opioid epidemic that is impacting communities throughout Illinois today. Senator Durbin, thank you so much for your leadership on all these issues and for joining us tonight.
Thank you very much, Lois. Thank you. Thank you all. Before I say a word about Lois, let me acknowledge a few of the many friends I have in this audience. State Senator Bill Hayne and his wife Ann, I'm glad you are here with us tonight. Bill and Annette Enyart, thank you. My former colleague in Congress and friends for being with us. I hate to start picking out lawyers, but I can't go any further without saying the name Tom Keefe. Bruce Cook, where did you go? Somewhere back there? He's probably going out to play billiards, which is what he did when he went to U of I Law School, if I remember correctly. That's what he told me. My cousin, real cousin, John Cody, the retired judge in Christian County. Thank you for being here with your wife this evening. May I say a word about Lois Wood? If you like to read books, you may want to read a fellow that I greatly respect, David Brooks, who writes for the New York Times. And I've come to know him and like him and admire him and agree with him most of the time. But he has a book now in paperback, The Road to Character. And it's a book of biographies of people throughout history. And he talks about evolutions in their lives. He begins the book, though, with an introduction and says, we have different virtues in life. There are resume virtues, which we list on our resumes, things that we have accomplished in life. And then there are eulogy virtues, the things they'll talk about when they bury us, that we contributed to this world. Now, when it comes to Lois Wood, she has both. She has resume virtues that are extraordinary, leaving Harvard Law School to come here to work with the poor and unrepresented is a dramatic example of professional commitment. And of course, the other virtues, more lasting, are reflected in the fine work that she's done. She's so widely respected that when I needed to choose someone to chair my committee to select federal judges, I asked her to do it. And I knew that no one would quarrel with that choice, and they didn't. And she came through with flying colors, coming up with a fellow named Michael Reagan. Has anyone ever heard of him? No, there he is. And we're so proud of you, Mike. And the federal judiciary in the Southern District, it is a great array of talented and dedicated professionals. Lois, thank you again for the nice introduction and for your good work. Joe Bartolak, I knew of him way back when I worked for Paul Simon, and he was actively engaged in the practice of law in Madison County. And I knew of his work with the Legal Assistance Foundation and heading it up, and I certainly know that he saw Lois as the kind of successor that he could, with confidence, hand over the reins. We're here to celebrate the Illinois Lawyers Assistance Program. I want to thank its president, J. Nelson Wood, and executive director, Robin Bellow. I also want to join in with the fine words that were said about Jerry Walters. Dan Cuneo told a great story. We appreciated his being here for that purpose. But I want to say a word about some other issues that relate to the reason we're here this evening. First, let me take you way back in history. This month, America celebrates and commemorates the 152nd anniversary of the end of the Civil War. That terrible, fiery trial may have preserved our Union and ended slavery, America's original sin, but it's entirely possible it would have had a much different outcome were it not for two adopted sons of Illinois. One, of course, Abraham Lincoln. The other, General Ulysses S. Grant, the brilliant general who led the Union to victory. Lincoln was America's greatest president. I can say that without any hesitancy. He was a man who suffered, though, most of his life with bouts of crippling depression. Ulysses S. Grant was always linked with alcoholism. During the war, detractors in the South and a few in the North conducted whispering campaigns accusing Grant of just being a drunk. One particularly bold critic even went directly to President Lincoln to complain about his choice of a commanding general. He had hoped to discredit the general, whom Lincoln had named commander of all the Union armies, but he failed. After learning the man's attacks on Grant, Lincoln replied, quote, "Find out what Grant drinks and send a case of it to each of my other generals." Historians tell us that Ulysses S. Grant's rumored alcoholism was mostly untrue, more smear campaign than medical fact. And Lincoln's reaction to the rumor, like so much else about him, offers wisdom to guide us even today. For one thing, Lincoln doubted the rumors. He also understood that substance abuse and mental illness don't define a person. They might be part of a person's story, but they're not the whole story. Joe Bartolak understood that too. And he knew that addictions and mental illness can be devastating not just to the person who suffers, but also to their families, their clients, and others around them. At the same time, Joe knew that it takes a huge amount of strength and resilience to persevere through addiction or mental illness. He knew that if you could treat the illness or addiction successfully, the person who emerged from the experience could be even a better lawyer, a better judge, a better person. Addiction and mental illness have gone through a lot of new thinking. How long ago was it that we talked about just say no and talked about the moral failings of people who were the victims of addiction? That conversation has changed, I think you may notice. Conversation about addiction now is a conversation about disease. We are also taking a look at mental illness and addiction when it comes to the basics. The Affordable Care Act is now being debated in Washington. One of the pillars of the Affordable Care Act was created by a Democratic and Republican senator, two senators who came together and made an extraordinary difference. One was Paul Wellstone of Minnesota, a garrulous liberal who had a brother who had mental illness. The other was Pete Domenici, a very conservative New Mexican senator who had a child with mental illness. The two of them came together with a basic premise and said, why doesn't every health insurance plan cover mental illness and addiction? They had to fight for years, fighting the insurance industry to include that as a mandatory provision, an essential service to be covered by the Affordable Care Act. They were successful finally, and the Affordable Care Act today mandates it. And if you follow, and I have to follow this every single day because it changes so often, we are now talking about reducing the cost of health insurance by reducing the number of essential services required to be covered. Guess which will be the first victim when it comes to cutting essential services? Mental illness and addiction. It couldn't come at a worse time. And I hope that those who are suggesting it don't believe that they're really going to save America money or spare people suffering. I'm afraid just the opposite is going to occur. And understand what's happening as well when it comes to this opioid crisis which we're facing across America. Not that many years ago, if you said someone died from a heroin overdose, you would identify that person very quickly and very accurately. Oh, that must have been an older African-American male living in the inner city. That story has changed dramatically. There is no town too small, no suburb too wealthy to be spared from opiate addiction and heroin overdose in our state or nation. The numbers are stunning. I've gone to Madison County, all the way to DuPage County, to Cook County, all across the state, and sat across the table and talked to people about these addictions, how they got started, and the endings, sometimes very tragic. And what has happened as a result of this, as we've seen this addiction spread across the state of Illinois in every corner among populations black, white, and brown, young and old, there's been a new conversation about addiction, a more positive conversation about addiction and treating addiction. We don't have nearly the resources we need, my friends, when it comes to mental illness or addiction in this country today. I think of Gateway, and most of you are familiar, those of us downstate know it intimately, but even those in Chicago may have heard about the amazing programs they offer. But their hands are tied. There's an office in Swansea, Illinois, for example, for Gateway that I visited. I met a woman there who worked in an office in southeastern Illinois, has been fighting opiate addiction for years, finally knew that she needed help, reached out to Gateway and said, they told her, we can take you in about 8 months. 8 months, where she had to fight that addiction virtually alone until she could get into the Gateway Center in Swansea. And we have some terrible laws that don't make it any easier. There are restrictions under Medicaid that you can't have more than 16 beds to treat people who are suffering from addiction. No more than 16. Go up to Haymarket up in Chicago. Some of you may know Monsignor McDermott's story. A man, this is an extraordinary man who gave his life to those who were facing addictions from alcohol and drugs. He left as his legacy this Haymarket project, which is exceptional, but it's limited to 16 beds for the city of Chicago, for goodness sakes. It makes no sense whatsoever. So there are things we can do to make a difference. The last point I want to make to you is one that may seem far afield, but stick with me for a minute. The gun violence in Chicago is heartbreaking. As Lois announced, I was born in East St. Louis. I say up in Chicago, I picked East St. Louis to be born because I wanted to be close to my mother. But that's a joke. But I love Chicago, and I'm honored to represent it. It's a great city. Breaks my heart what's going on with the gun violence in that city. And I thought, there's got to be something that I can do about it. Loretta and I were sitting watching 60 Minutes, that heartbreaking 20-minute segment, which talked about all the gun violence and murders in Chicago and the situation with the police department. And she turned to me and she said, somebody ought to do something. And I said, I guess I'm a somebody, and I ought to do something. Well, some of the things are obvious. Guns, economic opportunity, unemployment, and so forth. But by and large, others are looking at that. I stumbled on something, though, that I think fits into this evening's conversation and is really directly relevant to this violence issue. I went first with Tom Dart, the sheriff of Cook County. We visited the Cook County Jail, which is considered, at least in his words, the largest assemblage of those suffering from mental illness anywhere in the nation. They estimate some 40% of the inmates are suffering from some form of mental illness, and in many instances, that's exactly why they were arrested. Their conduct that should have been identified as not criminal, but conduct that was calling out for help. But then I went to the Cook County Juvenile Facility. Now, this is an interesting place because some of the adolescents are held there for brief periods of time, but if they are being accused of serious felonies, murder and the like, they're held sometimes in this facility for a year or more. So they've set up a high school, gym programs, and other things for these high school age young adolescents who are being held at the Cook County Juvenile Facility. When I went there, I learned that they had counselors, psychologists who sat down with these young people. And I sat down with one of them and said, what do you find? What do you find in these shooters who are spraying bullets into homes, killing grandmothers and toddlers, or spraying bullets into cars? What's going on in their minds? And the psychologist said, everything. Depression, bipolar, schizophrenia, you name it. But they said there's one thing that 92% of them have in common. The one thing they have in common is that 92% have either been victims of violent trauma or witnessed violent trauma. Dr. Cuneo, I'm sure, knows this story very well. The ACEs measurement of these young people, if they've been exposed to 4 of these events, traumatic events in their life, they are so much more prone to alcoholism and absenteeism from school and violence and the like. And you think to yourself for a minute, so what we're looking for is the treatment of young people who've been exposed to trauma, and for obvious reasons. Think about those returning veterans who come back from Iraq and Afghanistan and fighting in combat for the United States. They're adults, they've been trained, they had support groups around them at every minute, people monitoring them, and yet their exposure to trauma created the need for help when they came home. I grew up here in East St. Louis, and I can remember the Vietnam era. I did not serve in the military, but many of my friends who did came back broken by it. And we thought, what is wrong with that guy? He spends all his time in a tavern, his marriage has fallen apart, and he can't hold a job. What's wrong with him? Well, for some of them, it was post-traumatic stress. Now, put it in the context of a young person who's exposed to trauma. I go to Cicero, Illinois. There's a school with 1,000 kids, an Hispanic, largely Hispanic population. And they have a program there called Bounce Back, where they try to pick out the kids who've been exposed to trauma, the worst forms of trauma, and help them. I'm sitting there with a mother who explains about her 2 kids, whom I'm about to meet in a few minutes at the school. They were in the living room when her husband walked into the room and took his life in front of them. Imagine, 4 years old and 6 years old. A scene which they'll never be able to erase from their minds. They basically dropped out. They weren't interested in school. They weren't interested in anything after going through that trauma. But this program sat down and worked with them and brought them back into the mainstream of life. Now imagine if no one had ever touched their lives, what would have happened? What would their school performance be? What would be the next chapter in their lives? How badly could that end? The reason I bring this up is I think these are all tied together. I really believe that the issues of mental illness, the issues of addiction, and our response to it is being tested in ways it's never been tested before. There were times when mental illness was viewed not as an illness, but as a curse. What is wrong with those people? You know, we've got to put them away from the ordinary, normal population of America or wherever the country may be. But thank goodness we are coming to the realization that we have to look at this in a much different way. The lab program here has done it for my profession, the profession of law, which I still claim many years after the active practice that I was engaged in. But I think there's a lot more that we can do. We have to make sure that health insurance covers not just mental illness, but addiction. We have to make certain as well that we look at addiction in terms of a disease as opposed to some moral failing. And we have to also realize that trauma and its impact can really change lives and change them in a disastrous way in some instances. In 1862, after a near disaster at the Battle of Shiloh, when there were calls for Grant to be dismissed, Lincoln refused. He said, and I quote, "I cannot spare this man. he fights. We can't afford to simply give up on people who experience addiction or mental health challenges either. By giving your colleagues the tools to support and to fight addiction and other mental health challenges, the Lawyers Assistance Program is showing us a better way. Thanks for your good work.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.